Yo, Mark. So today I want to talk about AI in medicine. Are you ready to talk about it?
Ooh, let's go, bro. AI medicine. I got something similar, so pop right in, my boy.
My man. No, in general, I thought it was a very interesting topic because in general, I was just like, man, where does AI actually have a big impact? And then a friend of ours just recommended me the topic, and I thought it was really, really cool. So, in general, now, Mark, so what do you think are the main topics that AI can help medicine in?
Well, first top of my head is telemedicine, I'm guessing. So telemedicine is basically anything that is like, I don't know, over Zoom or something like that, or self-diagnosing or diagnosing. So you
Yeah.
basically have a chatbot where you're like, hey, I don't know, I'm feeling, for example, right now, I have to cough, and when I cough, I get mucus. I'm like, all right,
Yeah.
also have to cough when I deeply inhale. So I asked Dr. Gupta, for example, which is an AI tool. I was like, hey, I have these symptoms, and then it tells you, hey, you probably have respiration issues, but go and see a doctor. So there's limitations already. Other things, how about you pop a next topic, and then maybe I'll go another one.
All right. And in general, I wanted to split it up in three main topics. So first of all, of course, as you said, like diagnosis part. So that can be directly like self-diagnosis, because for example, in US, the average person waits 21 days to see a
Damn.
doctor. So, I mean, imagine you have something, a cough or something with your lungs, and you have to wait like 3 weeks if you don't go directly to emergency. So I think it's really, really good in that case with self-diagnosis. As you mentioned, Dr. Gupta is a really good tool for that one. Not FDA approved. Yeah.
Would you consider it self-diagnosis, or is it because you know what I mean? It's not like you self-diagnose and you're like, it kind of is, but it's not.
Okay.
You know what I mean? It's
Let's put
AI
this
wise.
way. You don't need a doctor. So,
Yeah.
I mean, you can self-diagnose in the case that you text directly with the AI tool, and that can help you out. Then, of course, the other one is like helping doctors like diagnose better and like
Yeah.
optimizing the workflow. And then the second one, that second topic I want to talk about is also speeding up drug development. And last but not
How?
least, well, we'll talk about it in a second. And then, of course, last but not
I
least,
like.
personalization of treatment with AI. Because I think these three main topics will be very, very interesting with AI tools. And of course, there are already a couple
I
tools
like.
that help a lot. But yeah, all right, Mark. Then let's just jump in with self-diagnosis. I mean, as you mentioned, yes, Dr. Gupta is a really, really good tool. It's quite interesting. Of course, the other tools as well. So I think that one's quite interesting and very easy to use. I mean, literally just chat with the bot and be like, hey, I have a cough, I have these symptoms. And it actually, like the prognosis is better than 95% of most modern
Damn.
medical doctors. So that's quite good. Of course, it's not, if you have something more grave or bigger, you should definitely go see like a doctor. But if you just wanna, you're not sure, rather just text him quickly instead of just saying, "Huh, that might be nothing." Now, Mark, how do you think it helps actually doctors? Because I think that's like where it gets like more interesting, right? Also on a B2B side, because that can be big money.
Well, all right. So doctors, I think it's in general, I think it's interesting because I'm guessing the AI will always have the latest news. Well, let's put it this way: latest newspapers, latest magazines, whatever, all the latest research in it. So I'm guessing, all right, this is my head. Five, maybe 2, 3 years in the
Let's see.
future, you have you have an AI tool. All right, this is
Yeah,
basically access just for doctors. This AI tool has been trained on all the papers out there. If something is
yeah,
peer reviewed, etc., and has specific, I don't know, studies, it has some specific guidelines that it follows, and it says like, hey, this is real research. Fucking
yeah.
goes in there, and then you can basically train the algorithm on it, and then even as a doctor you can type these in, and then it can give you outcomes like, hey, with a probability it's this and this, these are the symptoms, other symptoms, these are risk, etc. And then you have let's say 5 different possible results, and then you can like, hey, you can go through it yourself again, like, because you can adjust, right? You don't, just by typing it in, it's still different because you're not processing visual what you see as a doctor. It's just parts of it, so you can interact with it, and then it will be your a little assistant. You're like, I don't know, you're Jarvis just for doctors, right? What
All
Iron Man
right.
has, basically just for doctors. That would be super sick.
I like where this is going, but actually we are pretty much there, not completely yet, but for example, right now you saw it basically said like, hey, basically an assistant for the doctors. So right now, for example, there are a lot of tools out there that in general help with the workflow optimization. Because like right now, you have to consider as a doctor, it's not like you're going from patient to patient, but you need like you have the right radiology, like doing CAT scans or scans in general. Then the other doctor, the information flows. Right now, this is not optimized. So, for example, it's called Merative, which is called actually former IBM Watson Health, and it optimizes like basically store, manage, and then analyze medical data. So you directly have your patient's information always wherever you go, right? This sounds for us, if you work in tech, it's like basically a Dropbox or whatever. It sounds very easy to understand. But yeah, in medicine, this is still like a little bit, especially with data protection, a little bit harder.
Okay.
And yeah, they worked with like I think there's 7 out of 10 biggest hospitals in the US, and it's quite cool because in the end, and then of course you can see analyze the data, and then of course can see like, okay, this guy has a preposition for this part or not, and so this is one part, but I think which is actually more interesting if you go more specific. Like for example, let's take women, right? So if you have a mammography, so basically checking for breast cancer, right now, like you do the scan and then you manually like look at the pictures, like see whether there's like suspicious, like like the fat is like hardening or stuff like this. So you're looking for this manually, but
Yeah.
there are better ways out there. So actually, it's called Lunit Inside MMG. Let me just share my screen quickly because this is super interesting because it's also wait share. Here we go. Screen.
Luna. Okay.
Da, 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 da. Lunit Inc. Here we go. Alrighty. So what it does basically is also FDA 510K cleared. What means it's a like it's pre-market product, but it also already has the clearance of a product which is already released on the market, right? So it has at least the same efficacy, if not a better one. So in general, as you can see, like it's very accurate. But I think what's super interesting that it helps like between 5 to 12% like better like or more accurate diagnosis. Also, it looked at data regarding breast cancer patients who were like falsely diagnosed. So basically, they forgot or they didn't see that that the patient had cancer, breast cancer, and like 1 or 2 years later, they were diagnosed with cancer, and then it could predict like up to 60% more accurately that this person might develop breast cancer. So I think that's like quite cool because it can just catch it very early, right? So you can see here as well.
And do you know what they would do then?
Or 40%. Oh, here 60%. What they would do then in general, you mean what do you mean?
Well, if they can, oh, if you catch it early, right? It's not cancer, it's a pre-stage, I'm guessing. So is there like, hey, by the way, we directly recommend you to do this, I don't know, this treatment? Like, hey,
That is a good question.
not chemo, but maybe
I'm not a
lifetime,
medical
like,
doctor,
lifestyle
nor
changes?
am I. No, I sadly don't know. But that would be quite interesting to know how they like if they'd say like, hey, you're more likely to develop it. I'm not sure whether there are like environmental factors that you can reduce, maybe nutrition or something like this. But that would be something to ask for sure. All right, all right, Mark. So now we talked about breast cancer. I actually have another one, but I want to talk about it in the next podcast because I think keep it short, baby. Keep it short.
All right,
So,
what is the next one? Tease the audience, bro.
alrighty. I mean, drug development. I mean, how can you actually speed up the drug development, Mark? What are your ideas?
Oh, that's the topic for now, or is that for next one?
No, that's for now. The next one is for, or of course, if you have a broken heart. No, it's actually just to measure whether your heart is just still perfectly functioning or not, which is really, really important, especially for older people. So,
All right,
quite
right.
interesting.
So, all right, drug development. I'm guessing that you can
Yes.
run through scenarios with AI. You have theoretical cases, and I'm guessing because it has a lot of data points, it just knows, hey, this genetic component might react with this, I don't know, with this part of the medicine, and that's what it does. It does just the calculation.
Yes, I mean, I don't even need to explain it anymore. You basically explained it already very well. So yeah, basically it can
Yeah,
predict
buddy! Woo! I'm
it
a
can
fucking
predict
genius.
you are, Mark. You are. Basically
Yeah.
can predict the compounds which might work best. So, and that can, of course, reduce the trial and error method that's normally used. Just like, hey, maybe this might be mixing well with that one. So, yeah, well, that one is really, really cool. But that is the obvious one. But I think what's also really interesting, because after development, what's happening, Mark? So, let's say you mix a new drug. What do you have to do next?
Well, you have to test it with people. You have to
Yeah,
go
exactly.
studies. Well, first of all, mammals, so
Clinical
mice.
trials.
Exactly.
So in general, for the clinical trials, AI can help you identify the right candidates, and then it can also predict already the outcome, right? So you can basically, if you see the genetic like composition of the candidates, or like basically, and from that one, it could predict it. I mean, of course, this is not happening right now, but that will happen once per time. And that also comes to the last point, which like because if you have the genetic analysis analyzed, you can see biomarkers. Like with the biomarkers, you can see okay, he's most likely to have a disposition towards this disease, right? And then AI can help scientists to like work out like to prevent certain diseases.
So
So
I
yeah.
have a question. So we already talked about what I mentioned to you that it does the calculation in terms of hey, this might have an effect on this biomarker or whatever, and this might be the best component. But how does it do it? Does it because it knows a lot of research, or how does that work? Do you have any idea, or is it too complex for this pod, or are you? What's the
I mean,
status?
it's definitely too complex for this part, but in general, like any large language model, right, it analyzes a lot of data sets and then can relate cases, right? So it sees correlations in certain, like I say, candidates or like people, and then based on that, it can just like build correlations and say like, hey, probability that you if you have these biomarkers or these traits, you are more likely to develop this. And it's just like if you have enough data, yeah, you can correlate certain things. And of course, you need to understand it. That's why it's so important to use AI for that one.
I like. All
All
right,
right,
bro. Is
Marky
that it?
boy.
Do you got some else?
I got something else, but I can also
Tease
do
the
a
audience,
quick
bro.
word.
Come on, just
All
pop
right,
it real quick, and then we'll
personalizing
hop on the next
treatment
one.
with AI, right? So,
All right.
how you can personalize medicine with AI.
All right, I like. That sounds exactly the topic that I'm right now listening to a book to. It's called Life Force by Tony Robbins. Great fucking book. So I recommend it to everyone. Please listen to it or read it. I don't know. I think reading is like 1,000 pages. Listening to it is 24 hours. So worth the read
Noise.
or listen. Very, very awesome. I think in the future I'm also going to have topics on that. So, all right, guys, ladies and gentlemen, I have a very related topic to that. I'm going to talk about a company called Cionic. All right.
Ooh, what a psionic, Mark.
All right. Cionic is basically a bionic clothing for mobility impaired. All right. What does that even mean? Like
Exactly. I'm
bionic
like,
clothing.
all right,
I know.
give me a
I mean,
tease.
bio is
I'm
bionic.
hooked.
All right. So basically, it's a medical tool in clothing, so that has electrodes that will help you do movement specifically. This is specifically for movement impaired, like I already mentioned. So it's think of a knee sleeve, a little bit longer than a knee sleeve, that you can pull over one of your legs, and this will help you walk.
Just
All
one
right.
leg, or you can use it
This
for
is
both
one
legs.
leg. I'm gonna get there. Why, etc. So, why did this company start in the beginning? All right. So the founder had was affected personally because his daughter had cerebral palsy. Do you know what that is, Lucas?
No, please.
So basically, cerebral palsy is when you have some brain damage as a child or something, and that causes you to be movement impaired. You have, I don't
Yeah.
know, that's it's not something that is degenerative, so it's not going to get worse and worse, but the symptoms while you age might be different. So that means, for example, they walk funny. They have something. They're like, I don't know. Usually they have the ankles are like wobbly,
Ah,
so
is
they
it
walk.
like when they have also the feet a little bit sideways, or is this
Yeah, it
different?
could be. Yeah, one of these things could be one of the cases. Exactly. So his daughter has cerebral palsy, and he was like, "Fuck, man, like what's out there currently sucks. So I'm gonna do something about this. So he started in 2018, I believe. His company, it's called Cionic. I think they raised 18 million.
Not bad.
And now I think last year they finally got FDA approved for their called Cionic neural sleeve. So this is the knee brace that I basically told you. It looks kind of like clothing. So they wanted to legit. It's
have a
just like
picture?
fabric with. Yeah, one second. Just go on the website. It's called Cionic. They kind of look cool. I'm not gonna lie to you. So it's just like a clothing, like just like a Lululemon sleeve, kind of.
A little bit thicker.
A little bit thicker and longer. So what it helps is stabilize basically the muscles because it interacts on the level of the electrodes. So basically it has electrodes in there, so it sends more well, it
So it
makes
makes
it
the-
forces the muscles to contract.
It's the basically an impulse which makes the muscle contract harder, right? Because it might be not strong enough, or how does it work?
Yeah, so all right. So let's start with who's it for, right? So it's
Yeah.
for movement impaired people. So that means someone that had cerebral palsy or neurological issues in general, MS, like stroke
Yeah.
victims. So a lot of it in the first studies that they did was stroke victims. So
Yeah.
why stroke victims? I mean, you asked why one sleeve? Well, stroke victims usually have one side that doesn't work properly anymore, right? So, and for that side, usually the leg or whatever is not walking, like he can't walk or she can't walk properly anymore. So this will help coordinate basically the movement. Because anyone that has neurological issues, they have coordination issues. And with these kind of sleeves, it will basically reinforce or strengthen the impulse to the muscles so that the like coordination is better. For example, and as well, it's kind of cool. So, well, how it works is that you have an app basically, and you're like, hey, in the app, you're like, you have the sleeve on. It's like, hey, do calf raises.
my left leg.
And then it does the calf raises. So you don't even have to think about it. You can do that, and it's the same with walking. So this way, you can also train. So this is the concept behind it, so that people can train how it feels like, and they get the impulse, like, hey, this is moving. So, all right, I'm gonna
So-
practice by thinking about it and pressing the button, so it's
All
like
right.
supporting.
So did I understand it correctly? You can basically use it as a workout. So basically saying, hey, I do want a calf raise, but if I want to start walking, I don't have to open the app to tell like,
No.
hey, I'm walking, because I'm imagining just like walking, having the left step, left step, left step.
No,
So
no,
it's
no.
more
So
about
this is the cool things. Yeah,
like
yeah.
basically you practice.
No, so exactly. You have two options, Lucas. You have the walking, you directly
Yeah.
walk. So they did it with one lady, she had a stroke, and then she was walking in San Francisco again. Obviously, she was still helping walk on the side, and because she
Yeah.
was one foot was like sluggish, like it was like this.
Yeah, yeah.
So with this, you have more ankle mobility, and then you basically can walk safer. So you're not getting stuck on something like and you fall. So it's kind of
great.
cool. I think it was an 8% improvement, etc. on ankle mobility or something, which doesn't sound like a lot, but man, 8%, whoosh,
No, it can
That's
make
big.
a lot.
exactly. And this is just the beginning, and it's just the cool thing is like you don't need any implants or anything else. Literally, just fucking put the sleeve on. It looks kind of cool. And
Do you
can
know how
start
much
walking.
it is though?
Yeah, it's like $200 a month. It's a rental.
Ah, does the
Yeah, it's not bad.
Is it covered? Well, that's, I mean, 200 is also not cheap.
No
but,
idea.
Like, is it covered? That's a good question. 'cause,
idea.
Like, I mean, yeah. I mean,
I'm guessing that will be, but let's put it this way: in the U.S., how many are actually covered by good health insurance? So
not much. So yeah, that's true.
exactly. But
Like an expensive
so that
gym.
was
It's like an equivalent to an expensive
I know.
gym.
exactly, and it will give you. I don't know. I saw the videos and they just said it
Yeah.
was super cool. They felt easier. Also, it reduced cognitive load. So cognitive load is like they were feeling overwhelmed. They didn't feel secure while walking, etc. So with this, they have the mobility back, the confidence. They're killing it. You see a lot of happy old people. You know these
important.
commercials. So
They trick you with that one. They trick you with that one. But yeah.
they do. So, anyways, that was a topic for me in general. Also, I want to talk about market size real quick. So it's
Yeah, please.
28 million people in the U.S. have this kind of shit. And they get
What?
any kind of mobility impairment.
What's the age range? Do you know? Like, is there any like? Is it more the elder?
So it's
people, or
usually
is it
older people. It's usually older people. I mean, unless you have cerebral palsy, which is when you start when you're young. But most of
Yeah.
them are old people that had strokes, right?
Yeah.
or any other kind of neurological issue that could have that. So 28 million in the US, and I think in the world they say like 200 something million. And I'm guessing that's still low and it's going to increase because, I mean, strokes and heart attacks are inflammation based. So might increase because we're getting fatter and fatter. That's a tendency. So I'm guessing we're going to have more strokes. So this is a cool tool. I like.
Nice. Well, I'm sure there will be AI tools to diagnose it early so you don't get a stroke. So that might
Exactly.
be in the future, who knows? So we might get less strokes because we can prevent them, which is super cool. But yeah.
All right, this is the topics for me. I think next week I maybe want to talk about a little bit about my book, what I learned of it. Well, not my book, but Tony Robbins' book. And I think we should jump back in your topics, Lucas. Yeah, buddy.
Yeah, buddy. No, I think I want to keep it for the next podcast. So I would say let's call it a pod, bro. All right.
That's it,
Peace,
bro.
everybody. Catch you next one. Bye.
Twins out.